Alright, hey guys, I thought I'd finally get a video up regarding the biggest topic in the past 2 years, and this may be something that 10 years from now we'll be looking back and saying, how the hell did we survive it? And first of all, my prayers and my condolences to those who did not make it thus far. And I really hope that for those of us who are still around, especially those of us who are healthy and whatever, like, stay alert, be vigilant, listen to advice from healthcare professionals and especially, WHO and CDC, and follow your respective, SOP, standard operating procedures, your lockdowns. Try to be as selfless as possible, because being selfish during a time where there is a virus that everyone is combating against, it may come back to bite you, especially if you have children or elderly people, parents, grandparents, or whoever. This virus specifically targets the weak. It is truly survival of the fittest. And unfortunately, you may realize that a lot of people we love may not actually fit into the category of fittest. And therefore, we have to be understanding, we have to be accepting of the fact that everyone has to play a part in fighting against COVID 19. Now, before I start, I want to just give a disclaimer that I am not a healthcare professional. I'm giving this entire sort of information basis here based on a third person's perspective. And I want to tell you that I dare say that doctors may not know as much of this as about this virus as much as anyone else, basically, because a lot of the information that they get is the same information that anyone else can find up online by looking at the right references. You have to read through stuff like WHO, through CDC, through your local healthcare bodies, and especially the ones that are government approved. And also, even then, their information is constantly being changed, constantly being updated, because not everyone is fully understood this virus, because it's still relatively new. It's taking years of study, years of analysis. The vaccines have not been perfected. Otherwise, it would be able to be given to anyone from newborns all the way to the elderly. But we do have filters. Initially, we only gave it to the high priority group. We were worried about the pregnant mothers. Now, pregnant mothers can take them at certain times, but it's still not a safe thing for the newborns. And eventually, it may be perfected for newborns, and maybe everyone will be able to take the vaccine. But we still need boosters and stuff. So we still have a lot to learn about this virus, but always look for the right information. Try not to rely on your local, WhatsApp and shared messages and whatever, which do not, quote or refer to the proper sources. Now, what do we have about COVID-19 that I want to talk about, especially in, where I am in my country? I'm from Malaysia. So in Malaysia, we dealt with this pretty well in 2020, especially mid-year 2020, June 1st was when we actually had one case, and that one case too was an imported case. However, things didn't end there. Things got really escalated, so I want to go about how things have changed. So COVID-19 would have really ended if everyone actually stayed at home for an entire month. That was the ultimate solution we had to the virus, because vaccines were still in production, and it's also not really possible for everyone to stay at home for a month, because we have essential services. They are a thing. We have law enforcement, we have medical sectors, we have food and beverages. We have so many industries that have to work, banking, and so on and so forth. And without a lot of these industries working, the country's economy could actually come to a complete standstill, which will cost us in the long run as well, especially halted projects, fines, all sorts of things that will hamper us. But it's not a possible thing. We can't do an entire complete lockdown. So what we did was we did a lockdown for all those who are not essential services, and essential services operated as usual, right? And then what we went to is we looked into something called herd immunity. When the vaccines were actually released, the vaccines were developed and they were starting to be pushed out. Every country had purchased their own batch of vaccines and were beginning to test them in a selected higher priority group. But herd immunity will not solve the problem that we have here. First of all, we must understand what herd immunity is. So there we go. What we know. So population immunity, also known as herd immunity or community immunity, means that enough people in a community are protected from getting a disease because they've already had the disease or because they've been vaccinated. And from what we know from the way the vaccines work, you can still get the disease even after you are vaccinated. However, you will be more resistant to the effects of the disease itself. Coronavirus mainly is known as a flu virus, of course, has known to be giving you symptoms similar to cough and flu, and also lung infections and some heavy breathing, as well as headaches, nausea, vomiting, diarrhea for some people, and also commonly muscle aches. So all of these symptoms make it quite a terrifying virus, and of course the immunocompromised group don't really stand a chance against it. However, we just herd immunity alone is not sufficient because newborn and toddlers cannot safely be vaccinated yet, and the vaccines have shown to have a lifespan of less than a year, typically 8 months. I have that here in this article. So of course, there are references from WHO and CDC as well, but this was one of the main articles that actually stood out to me because this was one of the earlier ones that actually reported how long the immunity will last. And so they had clinical trials as well referenced. You can also click into this and look up the link. I will leave all the links below for you guys to have a look at later on. But essentially, it only lasts for typically 8 months. So what happens is that after these 8 months, right? After these 8 months, we're going to need something called a booster vaccine. And these booster vaccines are going to be continuously administered, especially to the frontliners until the virus comes to a permanent halt. And there's no end to it because we have not seen the variant, like the Delta variants especially, we haven't seen them subside. In fact, we are worried that the Delta variants may mutate even further, especially once the borders and like national travel has been restored, right? International travel, and the people from other countries come into your country go to other countries, and it may even make the virus mutate further, and also different types of vaccines may also force the virus to mutate in different ways. This also means that if someone is carrying the virus during the 8 months that they, what do you call this, even if they are vaccinated, right, they can still help to cultivate the virus in themselves and spread it the moment they even get a normal flu or cough, or even if they're kissing their children. Can you imagine if you're kissing your kids and you can actually, continuously spread the virus? So that one is actually here in this little article that I have. So, oops. Oh, okay, it doesn't really show that to me. Let me just look for it. Is it this one? No, not this one. Delta variant breakthrough cases. There's this particular one called breakthrough cases. Give me a sec. Yeah. This is it. This is it. All right. So, basically, what happens is you can still continue to spread the virus, and these are known as breakthrough infections, which continue to take place even after you are vaccinated. So this is also something they got to be cautious of. They also have a statistical figure and all of that. So breakthrough cases are also pretty scary. The fact that the virus can continue to spread, meaning that the vaccine is pretty much not going to stop the virus in any way. It's just going to reduce the effects that it has onto you. However, your children are still not vaccinated. Therefore, they can get the full brunt of the virus if they are immunocompromised, even in the slightest way. If they have any other viruses, any other infections ongoing, it helps this virus, like loads. And the vaccines also help the virus actually produce a more virulent strain that can last longer, be harder to detect, and may even become resistant to the vaccine itself. I have that in the Delta variant here. So the Delta variant is one of these emerging versions, which actually has grown by, in bodies of people, and a lot of the bodies that it actually grew through are people who are asymptomatic, people who are actually have drawn or created some resistance to the virus, and this is the reason why the virus mutates. If the virus is working perfectly fine, meaning people are not like everyone is succumbing to the virus, right? The virus is not going to want to mutate because it doesn't really need to. There's no reason for it to mutate if everyone is already dying, like it's already doing its job, it's already weeding out the weak. But the reason the virus can mutate and continue to spread is because people are actually being able to fight this virus, and therefore the virus creates a more dangerous version. And of course, we've heard all about this double masking and whatever bullshit. Trust me, all these double masking will only work if you can actually manage without touching your face while being completely sanitized. And you also got to remember that the virus can still spread through what do you call this, dust and air particles that go into your eyes, which means you also have to cover your entire face. So double masking alone is not good enough. Face shield plus a mask may actually be more effective. But anyway, these are just from what I've generally gathered. So all the vaccines do is make sure you get more of the like, even if you get the virus, you are safer, right? But how much safer exactly? From what the CDC has released, the percentage of people who die from taking the vaccines were around 0.02%, and I think I have that here. Is it? Yeah, is it under adverse effects? Yeah, it's under adverse events. Okay, so under adverse events, it shows that people can still get the virus and they can still die from it even after vaccination. So it's over here. There we go. And some of these percentages originally, especially this one that I'm looking at, is people who got the vaccine without getting the virus and died from the vaccine alone. So that means, roughly that's about um, what is it, 0.002% roughly, which is about 1 in 50 people. 1 in 50 people can actually die from just the vaccine itself. But then there's another interesting article, especially in Malaysia, which is what I want to refer to. 4 fully vaccinated individuals recently died of COVID-19 so far. And out of these 4 vaccinated individuals, let's see, here we go, this is the statistic. So looking at this statistic, 80 cases were partially vaccinated and 4 cases were fully vaccinated, which means there's 1 dose and 2 doses, right? So if you add the 0.6% with the 0.03%, you roughly get the factor of 1 in 50 people that actually died from being fully vaccinated, right? So this statistic is almost the same as the statistic of people who died just from taking the vaccine. So you can die either from just taking the vaccine and having some crazy, what do you call this, uh, like reaction, allergic reaction or whatever. And even if the doctors manage to save you from that, you can still get the virus after taking the vaccine and still have a 1 in 50 chance of succumbing to it. So it's quite scary in general, but it is still not as bad as the population of people who just died from, what do you call this, not taking the vaccine, which is about 3%, which is 1 in 30 people, right? So that is still worse. And also, you must understand the fact that the statistic has varied because initially a lot of people were not vaccinated, but now a lot of people are vaccinated. So the death rate of 3% has sort of stabilized. Like it could have been more, it could have been 4 or 5%, but it may have been brought down to 3% because more and more people are now getting vaccinated. Lockdowns were initiated, and people were also taking caution, with the face masks and everything. So we have brought down the death rate, but we have not solved the problem. The vaccine is clearly just a seatbelt. It does not prevent the accident which is about to happen. It just makes the collision that we are about to face a little safer. So, what the heck do we do then? Well, the answer comes back to not getting the virus in the first place or not allowing it to spread. The virus is known to last in the body for up to 3 months, which is, I think, in this one. Um, Interim guidance, let's see, is it this one? During isolation. Yep, I think it's this one. So that's actually a queue. Yeah. So the specimens for up to 3 months and so on and so forth. However, the spreading, or rather the ability to spread the virus, is not really there between 10 days after and almost close to 20 days, which is why the 2 week period is roughly given. So after 2 weeks, the patient or whoever the person who had infection was may not be able to spread it. However, you must understand that the specimens can still be found for up to 3 months in the respiratory system. So this means that if that same person were to fall sick from a regular flu or cough, within the 3 month period, there is still a slim possibility of them spreading the virus even after their 2 weeks of quarantine or whatever, right? Which is why the face masks are so important, right? But still, it doesn't really like all of that is just there, right? But what really, really, how it really, really went wrong was mostly, all after this thing, right? We had a 1st July event in Malaysia, especially, where we only had a single confirmed case, right? And that too, I believe, was an imported case. So there were no local transmission cases, which was pretty much a success for what Malaysia had done. But then I think we all know what happened. It all started with the Sabah election, the Sabah state polls in September, and Prime Minister of Malaysia at that time, Muhyiddin Yassin, had actually admitted that the Sabah polls had caused the current COVID-19 wave. And this thing really, it had a domino effect. It stockpiled. It went crazy, especially towards the end of 2020 and the beginning of 2021. And this was followed by the issues that MITI had. MITI had given over 95,000 companies the approval to operate in the total lockdown, which means we had nearly 100,000 companies and an estimated 1.2 million workers continuing to work, right? And this is excluding all of the regular essential services, because if you're essential service, like if you're medical staff, you don't need a MITI letter, right? So if we had, let's say, a 250,000 of medical staff, and then we had, of course, pharmaceutical companies, of course, we had F&B and all of these things, this 1.2 million could easily be 2 million, right? And then there's also the military and police who don't use MITI letter either. So it could be 3 million, maybe 4 million. So we had an average of 3 million as we go. This effectiveness amount reduction of 2 million workforce of the 3.2 million total workforce for the approved companies, right? So at the end of the day, we still had about 3 million people working as a result of the military, the what do you call this, healthcare sectors, and also the MITI letters still working. And based on that percentage of people that went to work, we can actually, just do the simple math that I believe our DG Noor Hisham was doing so effectively. You can use his formulas. He has a great, what do you call this? I think Facebook page or something. But yeah, he does this really nice graphs, and he shows how the infectivity rate works. And you can just do the math using the 3 million population, and you will get the figures we are getting today, which is about the infection rate of about 15 to 20 million. Actually, it's 15 million, 15, sorry, million, 15,000 actually. But we are getting close to 20,000 because, it's continuing to spread. But anyway, yeah, that's roughly the main things. And on top of the MITI letter issues, MITI letters had even further problems. They actually had fake letters that were being approved, and people were actually traveling back. And also there were a freeze of MITI letters that took place several days after people had already issued letters to travel and had actually traveled back home. And there are a lot of people who had especially started the Hari Raya holidays, and you can't help it. People had been under lockdown for almost a year. They want to go home. They want to see their families. They want to see their friends. And they want, some of them actually can't even see their their loved ones, like their girlfriends and their boyfriends. They can't meet them because they're not married, and they have to get married just to get a letter to go and see their spouse. So if they are not married, they can't get that letter, and they're either forced to get married, or for those who don't want to get married, they can't really do anything. So this is also another opportunity for them. So all of these continuous gaps in between our lockdowns is pretty much what caused the main problem in the country. But aside from that, we must also not, remember that as for the general labor force that were allowed, or rather told to go to work, was it under this one? No, actually, I had the percentage somewhere. 60. It is about 60 to what do you call it? 60% or something like that. Give me a sec. Let me find that. It says 80% of government staff and 40% of private sector staff must work from home, which means that 20% of government staff and 60% of private sector staff will be continued to required to go to work. And especially, let me tell you, private sector companies, if they hear 60%, for them it's 70%, it's 80%. They will try to push as many people to work as possible. Now, I do believe I may have misplaced that particular article. But anyway, I do have the workforce statistics, which I wanted to show you guys. So as for the workforce statistics, if you can see, the labor force in the country is an average of 15 million, right? Population is about 30 million, which means half of our population is working. And this excludes foreign workers, all right. So foreign workers consist of about 10% of the country's population. This is about 3 million. So there's about 18 million people who are part of the labor force. Now, out of the 18 million people, let's not consider about the government sector employees, because they're actually lesser than the number of private employees who are forced to go to work. So let's say 60%, right? Let's say 50%. Let's say 50% of 15 million people, or rather, 18 million people went to work. That's 9 million people still working. This is why children can't go to school anymore. People can't safely, take their dogs for a walk because they don't know who they're going to meet. They can't play any sports anymore. Our health is declining, not just physically, but also mentally, because of all of these restrictions and this continuous loop that we are stuck in, because people just can't stop making these mistakes, right? We just have to do this over and over again and create problems for ourselves, despite what we had actually come to, which was a single case on the 1st July of 2020. Everything would have ended there, because all that needs to be done in order for the virus to be stopped is people just have to stay in one place and not spread it. And after 2 weeks, maybe a month, if no one coughs onto each other, there will be absolutely no cases, because there's no reason for a case to take place. Now the reason the cases are taking place is because people are working. People are working as almost as usual. When I get out on the road and I see the cars, people are going to work like there's no COVID, like there never was a COVID. Especially in states like Selangor, like KL, like Penang, like I think even Johor and maybe even Sabah. Majority of the population are still working. So even if you reduce the number of people working by 50%, right, it doesn't really change how some companies which have 1,000 staff are still going to have more than 500 employees going to work. So anyway, back to the entire point that I was trying to make. This is just my little video that I wanted to make on COVID-19, something for me to also look back on in about a few years to come, hopefully when this pandemic ends, to see what really my thoughts were at this time. And a sort of, aside from being a sort of a monologue to myself, this is an information transfer that I can give to you guys and tell you that people who know about COVID-19 are people who are reading the right stuff, right? Because people who didn't do it, like I've watched on TV doctors, right, saying that, oh, if you take the vaccine, you will be fine. Nothing is going to affect you. You may still get infected, but you're going to be fine. And then we started to see deaths even after taking the vaccine. And then the Delta variant was born. The Delta variant, I think, was born just shortly before most people actually completed their second doses, which made it even scarier. And then the virus becoming more virulent. We went from one mask to two masks. What's next? We're going to wear an astronaut suit and walk around with our own oxygen tanks. They're already selling oxygen online. It's like a thing. There are some psychopaths out there who are selling oxygen online, like from different countries and stuff. I mean, it sounds pretty cool and all, and apparently oxygen can get you high to some extent or something like that. I've not tried by myself, but anyway, yeah, I don't want us to come to such a terrifying point in time. Regardless, I'm staying safe by working from home because my job allows it, but things may change. I may have to go to a place where it forces me to go to work every other day, and you guys may also be forced to start your business or continue your business, which without which you can't survive. And also the government has run out of funds. They can't support us. They can't give us. Initially, Malaysia actually gave everyone this sort of like a discount on their bills and whatever, electric bills, water bills, had like a discount provision were being sent to homes. But you know what happened towards the end of 2020? People, like the community of people themselves, were helping each other because the government had no funds to help people, right? They needed their funds to continue to pay those people who are working in these essential sectors. And as for the rest of the people who are stranded because they used to run stalls, they used to run restaurants, they used to run side businesses, they used to run consultation work, they used to run psychological consultation, sports, especially sports trainers, sport athletes, young coaches, and all of these people have all lost their jobs. And the ones who are helping them are just Malaysians themselves, looking out for whoever was waving a black flag or whatever. And all of this took place during a government that is still undecided, which I am not willing to talk about because all Malaysians know that will get them in trouble. So yeah, this is my little video about COVID-19 for you guys, about everything that I've learned, everything that I've seen. I will try my best to link all the articles that I have mentioned below, and you guys can read through for yourselves and try to get the right information. And also take note that if you are from a different country that is not the same as me, some of this information may vary, especially the percentage of deaths of people who are already already vaccinated, because your hospitals, your healthcare may operate entirely differently. You may have different facilities and whatever. So I can't speak on behalf of that. However, as for my fellow Malaysians, this is what I have for you, and try to stay safe. Try to just keep trying to be vigilant, especially. It's something that we have to do in this time and not be selfish about things. We have to understand that it I mean, all of us think, all we think about is like, until we know someone we actually have seen or spend time with die, we think that, oh, it's fine, it's a thing, it's happening out there, it may come, it may not come, we are fine. But the moment it happens, the changes you go through are just not very pleasant, let me tell you that. So it's best we just, listen to the right advice, and just, read what you need to read. You don't have to go to the doctor. A lot of the time I hear that doctors are being, like, people are going to the doctors and arguing with them, telling them, why should I take the vaccination? Can you guarantee there'll be no problems with my blood and my body? Can you guarantee I can get a child after this? Can you guarantee I'll be fine and whatever? Let me tell you this, all right? The doctor's job is just trying to consult you about what you're going to face at that point in time, and to get your consent for the vaccination, and to get you vaccinated. And the rest of the information that they get is given to them, right? None of the research about COVID-19 is being done by the majority of doctors. And I say majority, okay? Because there is a small minority who's directly involved with the research, and most of them may even be working with MLTs, lab technicians, scientists, biologists, biochemists, and these people who are actually working on the virus itself, working on the vaccine itself. So it's no point you go to a doctor and argue with them, because let me tell you, priests, politicians, and doctors are the only ones you're going to pay for with no guarantees about what's going to happen to you. That's the best way I can put it to you, right? So it's all about faith at that point. They will do their best for you, they will wish their best for you, but at the end of the day, it's not in their hands. If you ask them, or like, what, like, can you guarantee that all this is going to be fine? They will say, no, there's no guarantees. It's just the way it is. I can give you my word, but there's no guarantee. So you don't have to go and bother these doctors. You just gotta just read online, look at the statistics, especially now because we have a lot of people who have gotten their vaccines, a lot of people who have actually come out of infections, who can actually speak up for themselves and tell you what their experiences are like. I saw so many vlogs and whatever of people actually reporting their experiences, and it's really nice to see how people fought through, especially even Delta variant cases and all of that. So yeah, do your own research. Be smart about it. Don't pick the wrong fight, and hopefully this video doesn't pick the wrong fight too. So I'll see you guys in the next one. Take care.